Corona. Here's what you need to know about illness and how to keep you safe. Before we start, do not forget to subscribe to the channel and activate the bell to receive all new. Coronavirus poses a global threat after infecting many people and hundreds of deaths around the world, and after China invited those who recover from the disease to donate their blood to benefit from the antibodies that their bodies made in making a cure for corona.
What are the symptoms of infection with coronavirus? There are many symptoms that, if they arise, should go directly to the nearest hospital, including body's temperature raising, feeling very tired and unable to perform any activity, dry cough, difficulty breathing, nasal congestion, sore throat.
What are the best ways to prevent corona infection? There are several tips that should be taken to prevent and reduce the chances of coronavirus infection, including always clean hands by rubbing them with an alcohol disinfectant or washing them thoroughly with soap and water for at least 20 seconds. Clean and cook foods well on fire until it kills the presence of any virus. When coughing and sneezing, be sure to cover your mouth and nose with your folded elbow or a tissue, and dispose of the tissue immediately and wash your hands. Avoid approaching people with fever and coughing. If you have a fever, cough, and difficulty breathing, seek medical attention early and inform your caregiver of your previous travel. When you visit the markets for live products in areas experiencing new cases of coronavirus, avoid direct contact with live animals and the surfaces that come into contact with those animals. Avoid eating raw or undercooked animal products. Raw meat, raw milk or animal organs should be handled with care to avoid the contamination of pollutants from uncooked foods, in accordance with good food safety practices.
Is there a cure for the new coronavirus? No. Although many patients recover from his symptoms, there is no known treatment. However, the first American study on finding a drug to treat the new coronavirus in humans is taking place at the University of Nebraska Medical Center in Omaha.
What about the vaccine? Scientists are working on a vaccine for the virus, but they don't expect it anytime soon. The National Institutes of Health are trying to develop the vaccine, but say it will take at least a few months before clinical trials start, and more than a year for the vaccine to become available. Dr. Peter Hotz, a vaccine scientist at Baylor College of Medicine in Houston, said scientists in Texas, New York and China are also separately trying to produce a vaccine. But the challenge is enormous. The lesson that we have learned is that coronavirus infections are serious, and it is one of the latest and greatest global health threats.
If you like the video, don't forget to subscribe to the channel and activate the bell to receive all new